Hello, Miss Sandra.
Hi, Dr.
How are you doing?
I'm John, her husband.
Okay, nice to meet you. I'm Dr. Reichert. Okay, here's some of the reported findings, what we covered last time. Basically, I'm going to go over briefly what we covered last time, so that you know as well. And then I might have some questions for you, and maybe some for you even. And then we'll go through the treatment and cost and everything else at the end. So what is your chief complaint right now?
Well, I have numbness and tingling, and it starts on this side of my bottom, goes all the way down the back of my leg. And it's there. It's not there all the time, but the majority of the time it's there.
Okay. Does anything seem to make it better or worse?
No, I went to my regular physician, and he gave me some painkillers and muscle relaxants, and I was on that for about a month. There was no change, so I went to an orthopedist doctor, and he's prescribed physical therapy. I did that for about a month. Nothing helped.
Okay. Yeah, I see where you visited your general practitioner and the orthopedist, and I had some x-rays from him. They do show some osteoarthritis and some disc thinning. We'd have to do an MRI to really know for sure if this is possibly a disc herniation. We're going to try some conservative care first. And, you know, we'll figure that out later. From the presentation, it does look like there might be a herniated disc, and so I'm going to keep that in the back of my mind just so that you know. We might have to do something about that. So how is this affecting your daily life?
Well, I've got 3 kids I have to take care of. I'm unable to stand for long periods of time to get my housework that all needs done. He's having to help with it. And it's affected our intimacy because I'm in pain all the time.
Okay. Yeah, I feel for you. I'm sorry to hear that. And this can be rough, especially whenever you have some pain that's been going on for, 3 months. That's a long time to be in that kind of pain. And if it's affecting your daily life and everything else. Well, I'm going to explain kind of what we have going on. The nervous system, if you can see, we already covered this, but what we call subluxation is whenever we have joints that are putting pressure on nerves. These are nerves,
Right.
And it causes dysfunction. It could be whether it's your lungs or it could be muscles. And here's some sheets actually that you can look at to see where these go. These different nerves can go. I believe you remember those from last time. Okay. And if you do have a disc herniation, then it's similar to something like that. That is a herniated disc, and it can also put pressure on the nerve and cause issues on everything below it. And yours would be about that level, except a little higher. So, do you have any other things that are pertinent in your history that I might need to know about?
Not really. I've had asthma since I was a kid.
Okay.
Now I have difficulty sleeping on account of the numbness and the tinglingness. It's really, really uncomfortable.
Okay. Yeah, I'm sorry to hear that too. That can be a bad thing whenever you can't get enough sleep in. From your exam findings, I found from your posture that you've got a high right hip, which, it's got some contraction going on somewhere. It's only musculature that's guarding. You've got a high left shoulder, which is typical and causes a wedging of the spine. It's kind of making your spine go like that, and that's putting pressure on these nerves as well. Some postural correction things are going to be in your treatment plan to help improve that. I also found that your cervical lordosis, or the straightness of your neck versus the curve, it's really straight. You need a good curve to keep alignment and prevent it from having degeneration. Yours is really straight, and that's something that we can work on. It's caused by looking down at, reading a book or on your cell phone or on your computer typing. Whenever we have impingements like this, it's kind of like going through a tunnel in your cell phone. It gets crackly, you don't get the full message through. And that's what I believe is going on, causing her symptoms. On your range of motion, you had some decreased ranges here and there. The Valsalva test was negative, so I don't know if it's a disc herniation for sure. That's normally a positive, but we will probably have to get MRI further down the road if that's what I still suspect. So some of your reflexes on the right were decreased, as well as the muscle size. So it's now began to atrophy, and that's because it's been going on for 3 months. You've got some decreased touch and sensation. That's all pointing to nervous system, all throughout the cervical spine, some in the middle of your back, and some at the lower end. You've got some restrictions. We found some tenderness whenever I was palpating you. So basically we're going to start with adjustments, and then we're going to do some physical therapy modalities such as premodulation that will decrease your pain, and then ART to relieve some of the muscle tension, and traction that will help your disc to be regenerative a lot better and obtain a lot more nutrients. The cost is going to be about $50 a visit. It's going to take possibly up to 12 visits or more or less. We're going to start off 3 times a week for 2 weeks. I'll re-examine. We'll do 2 times a week for 2 weeks, and then try to decrease and get you on a wellness care basis. If you have insurance, the copay is about $15 to $20 per visit, and you can discuss that further with my front desk lady. We'll get into adjusting you and go from there. It was nice meeting you.
Real nice meeting you too.
Thank you, doctor.
Nice meeting you again, and we'll get you
We'll
back.
see you later.